Good afternoon. Thank you for joining us for our daily briefing. Remember that COVID-19 is still out there, so we will continue to keep you informed and to keep you safe. But you need to play your part also. This is now more important than ever as we relax the lockdown measures. So we will again repeat our public health message and urge you to act upon what we say. I am joined today by the Acting Medical Director, Dr. Krish Rawal. I will start with an update from A&E and with the latest test data. Remember that anyone with the symptoms of COVID-19 should call 111 first. In the last 24 hours, there were a total of 38 attendances at A&E. 4 of them had COVID symptoms. 3 were swabbed. There were no admissions into the COVID ward or into the COVID CCU. This morning there was 1 patient in the COVID ward and there were no patients in the COVID, 1 patient in the COVID CCU and there were no patients in the COVID ward. The latest test data is as follows. Total swabs 3,252. Results pending 251. Results received 3,001. Confirmed cases 144. Active cases 8. Recovered cases 136. The 8 active cases are at home. A total of 663 of the swabs refer to the frontline, targeted and systematic sample. I want to recap briefly on our April data. We started April with 46 active cases of COVID-19 and with 770 tests done. The number of active cases then dropped to only 2 on the 24th of April and then shot up to 13 6 days later on the 30th of April, the last day of the month. By then we had carried out 2,626 tests. A sample of 400 people selected at random was completed and another sample of frontline staff commenced. The point I want to highlight about April is this. The number of active cases went up from 2 to 13. It did so quickly. This is precisely what we need to guard against. Today you will have heard there are 8 active cases. Again, this can change. We must not let down our guard. The virus moves fast. That is why we continue to urge you to follow official advice. The grand total of 3,252 tests so far is some 10.2% of the population. This is an important milestone. In terms of tests done per capita million, Gibraltar is now ranked at number 6 in the world. We continue, therefore, in the global top 10. Moving on now, and by way of update, yesterday the Chief Minister and I met with members of the UK All-Party Group on Gibraltar. The main topic of discussion was COVID-19. I am pleased to report that considerable interest was shown in Gibraltar and also considerable support was expressed. 18 group members joined the virtual meeting from the House of Commons and also from the House of Lords. And this included the chairman of the group, Sir Bob Neal. So there were Conservatives, Labour, Liberal Democrats, Scottish Nationalists, Ulster Unionists and independent parliamentarians represented. A wide breadth of cross-party support remains in place. The MPs were also full of praise for Gibraltar and for our actions in dealing with COVID-19. Their message was clear. They will be there for us when we need them. I want to say a few words now about aviation. This crisis has hit the airline industry hard. Air travel is restricted. Planes are grounded. Airlines are on the verge of collapse. British Airways has announced thousands of redundancies. Ryanair also, and yesterday Virgin Atlantic as well. Nobody knows when the situation is going to improve. But one thing is clear. Like everything else, air travel will never be the same again. Manchester, East Midlands and Stansted airports now require passengers to wear masks and gloves. The use of face masks is likely to grow further. Monitoring of temperature also. The middle seats on aircraft may need to be kept free. Lengthy health checks will be added to lengthy security checks. All this will make flying more time-consuming, not to mention more expensive. In UK, there is already talk of spending 2 weeks in self-isolation for all arriving passengers, even for British citizens. This morning I spoke to the Air Terminal Director, Terence Lopez. The government have already purchased 10 thermal mobile temperature scanners. They arrived in Gibraltar last week, and you will have seen one of them deployed at the border. The mechanics of their deployment to the airport is currently under discussion between the Director of Public Health, the Borders and Coast Guard Agency, and the air terminal. The government is grateful to them and to all those who keep the lifeline flight to Heathrow going. On the same subject, I know that many of you have asked questions about flight cancellations. Many of you have booked flights and are understandably uncertain as to what will happen. You may have heard nothing from your respective airlines. Perhaps your flight is not until July or August, and nobody knows when operations are going to resume. Certain airlines have already contacted customers. Some have cancelled flights. You enjoy certain rights in those circumstances. To be clear, when the airline cancels a flight, those rights apply if you fly on an airline registered in an EU member state, or if your flight departs or lands in an airport of an EU member state. In such circumstances, airlines are obliged to offer customers a refund, rerouting at the earliest convenience, or rerouting at a later date chosen by the passenger. This covers flights between Gibraltar and the UK. It does not cover flights to and from Morocco. The EU guidelines can be viewed online in the transport section of the EU website, www.europa.eu. Also, there is more information on the Office of Fair Trading of the Government of Gibraltar. This can be found at oft.gov.gi. However, understand that the rules are different if you cancel the trip yourself. A refund then depends on the type of ticket that you purchased. In such cases, you should contact your airline first. The British Airways flight schedule to Gibraltar has been changed today. BA will now link Gibraltar to Heathrow every Monday, Wednesday, Friday, and Sunday. At the same time, the procedure for diverted flights continues to work smoothly. The latest instance was last week, when a British Airways flight diverted to Malaga due to strong winds here at Gibraltar. There were no issues with the transfer of passengers to or from Malaga. However, on Sunday, 4 BA passengers were refused entry into Gibraltar. All of them lacked the correct documentation, and 3 of them had intended to cross into Spain. Gibraltar residents continue stranded abroad. That number is now up to 61. Some good news is that the person stranded in Dubai is now back in Gibraltar. The number in Morocco, though, has increased from 47 to 50. The others are 9 in India, 1 in South Africa, and 1 in the United States. Some of these may return on rescue flights to London. We are looking at different plans for the return of the large group from Morocco. The country is in lockdown until the 20th of May. The problem is compounded because dual nationals are not allowed to move around. A list has been compiled of welfare and medical cases. There are 26 people on the list at the moment. Efforts have been made to see whether the return of this group can be expedited. The Moroccan Community Association is also in contact with all those affected and with the Office of Civil Contingencies. We are very grateful for their help. Discussions continue with the relevant authorities. Now a short update on the construction industry. As you know, construction work can now resume on self-contained sites, but on a permit basis. The permits will set out strict controls on workers and on construction companies. Until now, construction has been largely closed, except where a permit has been issued by the Chief Technical Officer. For the record, since the 23rd of March and until the end of April, a total of 28 construction work certificates were issued. 43 formal applications were declined. Countless verbal requests were also turned down, and some permits have expired. There were 20 active certificates at the end of the month. Cross-border workers remain subject to strict controls. All COVID-related projects remain exempted. However, please remember that minor works at residential or office premises are still not allowed. As you can see, the pandemic has forced us to change the way we do things. This is happening everywhere, all over the planet, and across all areas of our daily lives. Going to the beach is no exception. Almost from one day to the next, beach weather is now upon us. Many of you have already gone for a swim. This is normal, given the heat. But understand that the situation itself is still far from normal. The 2020 beach season will sadly be unlike anything we have ever seen before. You can go to the beach to exercise. This means to walk, to run, or to swim. We cannot allow beaches to become crowded. The virus would thrive in that environment. So you have 30 minutes during which to swim and then go home. This means no deck chairs, no umbrellas, no inflatable boats, no sunbathing, and no picnic hampers. You must maintain your social distance and stick to your own household. So no barbecues, no beach parties, no breakfast, lunch, and dinner at the beach. The summer season will be tough. We know that it is a hard sacrifice to ask of you. We are called upon to change decades of tradition, to switch to a different way of doing things, to adjust our Gibraltarian way of life. But as we do so, we cannot lose sight of the wider picture. That is the need to protect our people, to protect you, and to protect our country. So in short, you arrive, you swim, get dry, and go home. In this way, everyone can have their turn. The situation may change, but this is the blunt message for now. And remember, the RGP and other bodies are there to help. They too enjoy the beach. They too have families in the same predicament. Listen to them and act on their instructions. Cheating creates a risk because you will only be cheating yourself. You or your family could catch the virus next if you cheat. So understand that COVID-19 is still with us. It has not gone away. The number of cases may be low. Gibraltar has emerged relatively unscathed, and we have prepared very well. But all it takes is a single spark. One infected person can pass it on to many others, and then on and on and on. So we have to protect ourselves, and to do this, we have to follow the rules. Otherwise, we open the door to the virus and potentially to a second wave, which would be far worse than the first. I have to say, though, that most of you have been disciplined. You have listened. You have acted on the advice given. You have followed the rules. Your government is proud of you, of your collective sense of purpose, your sense of responsibility, your sense of duty to each other. Sadly, a minority do not see the bigger picture, and this is not safe. In fact, it creates a risk for everyone else. Indeed, it can also spoil things for everyone else and lead to a tightening again. I cannot stress enough the importance of following the rules as we move into lockdown. This is not over. Listen to what we say, act on our advice, and follow the rules. Before passing on to Dr. Rawal, let me repeat a public health message once again. This is to listen and act on the advice of our public health experts. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, please stay at home. Maintain social distancing. Do not mix with other households. If you need COVID medical advice, call 111. For non-COVID medical issues, call 200 722 66. If you have any other question, call 200 418 18. And for emergencies, call 190 or 199 as usual. I now pass you on to Dr. Awal.
Thank you, Deputy Chief. Good afternoon, everybody. I hope everybody's safe and well. And if you are going out, that you're keeping to the social distancing rules, you're washing your hands frequently, and that you're looking after yourselves and making sure that your trips are essential trips or exercising for only 30 minutes. Just a couple of little clarifications on some of the points that Deputy Chief has covered, and then some progress updates and some research updates from me. So, Deputy Chief did mention the total number of swabs, so 3,252 that we've taken. I know a number of people are slightly confused on that number. Some people thought it was only 1%, but it actually is almost 10% of our population so far. In terms of the targeted sampling, which is what has really boosted our numbers, we've so far tested and are in the process of testing staff from the prison and also inmates from the prison, the MOD, Ocean Views, Mount Alvernia, Hillsides, Care Agency, ADA, St Bernadette's, the GHA, Bella Vista and John Macwing. And in the next few days we will also be offering swabbing for the teachers. And dates for those will be announced through Public Health. I know we go through the bed statistics as well. Just to give you a very, very quick bed statistic, the grand total is 760 beds across all of our sites at the moment, of which 346 are occupied and 414 are free. If you work that 760 out, that works out to be enough beds for 2% of the population, which I think is a fairly impressive total. In terms of progress update for St Bernard's, at my last press conference I talked about our restarting our clinical activity. The restart plan is to be tied very closely with Chief Minister's Unlocking the Rock working document and the timeline that the Chief Minister is working on with that. But just to let you know, as of the beginning of this week, the clinical teams have already started with this phased plan. What the team are doing at the moment, some of them have been doing it throughout the major incident, but teams have already started to compile waiting lists of all the patients on their waiting lists. These are the routine, the elective, the non-urgent patients who've been referred and who are waiting for appointments, and these appointments have been postponed. I deliberately use the word postponed as opposed to cancelled because we haven't forgotten about these waiting lists. So the clinical teams are going through these waiting lists. They're calling patients to see whether people still need the appointments. There are some people that may very well not need those appointments now. And then from there, we will take through to the next steps of the Unlocking the Rock plan and tie our timeline totally in with that. Part of this will involve, and I mentioned this before, but if you do come into hospital, if you're having a surgical procedure, there will be a formalised pre-assessment process for you before you go to surgery, and that will involve, in terms of some surgery, up to 14 days of self-isolation before you even come in, and potentially longer depending on the surgical intervention, and that will be advised by your surgeon and your clinical team, and a pre-assessment about 48 hours before your surgery, which includes swabbing for COVID, and also MRSA and CRE, which are these bacterial infections that you can pick up in hospitals, which are antibiotic resistant, which we also screen for. We were screening for those before, but we'll include them as part of the pre-assessment process. Now, most importantly, as part of this, we are asking our clinical teams to do a risk assessment scoring tool. It will depend on what it is that we're doing. Some minor procedures or even interventions or diagnostics, such as x-rays, may not need a risk assessment scoring tool, but anything more involved, we will use the scoring tool to essentially work out this risk and benefit. So there may very well be a greater risk posed to somebody coming into the hospital than there would be from just waiting for a little bit longer to have your procedure. But this will be down to you and your liaison with your clinical team and your surgeon and your clinician. In terms of the next steps, as I say, this will be linked in with a timeline for unlocking the rock. We will go to half lists of interventions, imaging or procedures, such that there's space between patients so that patients don't bump into each other, don't cross each other, so that we reduce the risk of cross-infection. There will be gaps between patients, but we will certainly aware also there's a number of people concerned about screening. This is screening including mammography, the colon cancer screening, the aortic aneurysm screening, the cervical screening, a number of screening interventions. And we will be starting with patients who have had screening and have been recalled for an earlier review. So normally if you would have your screening perhaps once every year or every 2 or 3 years. Now, if you've been requested to come in earlier, but that's been delayed, we will start with patients who are waiting for those first before going to routine screening in due course. Moving on to a little bit of public health, although I appreciate that I'm not the Director of Public Health, but Dr. Bhatt has asked me just to cover very quickly or reiterate about PPE. Now, I know that PPE is a source of confusion for many people. You know, should I wear a mask? Shouldn't I wear a mask? When do I wear a mask? When do I not? Do I wear it in a shop? Do I wear it in the street? Do I wear gloves? Lots of confusion, and some of that confusion has come simply because the guidance has changed, and so that confusion has arguably come for everybody. And of course, we follow the guidance as best we can. However, Public Health Director has asked me just to remind everybody about masks. Deputy Chief has mentioned about airports asking people to wear masks. Please remember, the mask is there not to protect you, but to protect others. And this is the reason why when somebody walks into the hospital and enters a patient area, we ask you to use your hand gel, we do your temperature screening, and we give you a mask. The reason for that is to protect somebody who may very well be unwell, or somebody who may be older and therefore may be more vulnerable to this infection. So the mask is not there to protect you. What will protect you is social distancing and washing your hands and not touching your face. Those are the things that will protect you. So if you are asked to wear a mask, for example, with the first phase of this unlocking and the opening of some stores, if a shop cannot stick to the social distancing rules, we can offer masks to people. So if you are wearing a mask, please wear it properly. It needs to cover your mouth and your nose. And it has a little metal strip that you can press across the bridge of your nose. I know it's not particularly comfortable, but that's the best way to put a decent fit on there. Please don't pull it down and wear it on your chin. It won't give you any benefit, and you may as well not wear it. And if you're in the car on your own, you don't need to wear it. Save your mask for when you need it. And when you've finished with your mask, please throw it away properly. I've seen lots of masks discarded on the street, which seems a great shame. If you put into context that some weeks ago, the top of the headlines everywhere were about shortages of masks across the world, and now we're disposing of them as if we don't need them. So these are very, very precious. So please either use it properly, and when you've finished with it, throw it away properly. Now, moving on, I always like to give you a little bit of update on the research. And the first thing that I'm going to talk about with the research is vitamin D. I mentioned it the other day, and I know that a number of people were quite interested in this, and I mentioned it fairly briefly, so I'm going to go into more detail with that. There's one study I read which only had 20 patients. So it's a small study, which was 20 patients who were all admitted to an intensive care unit with severe COVID infections, and all of them, so 100% of them, had very low levels of vitamin D. And then another study, which is a UK-based study, Oxford University, has shown that daily vitamin D prevents other respiratory tract infections. This is quite important. This is not specifically for COVID. And it concluded in this study that the UK population should take vitamin D supplements to prevent deficiency in vitamin D, but not specifically to prevent or treat COVID. So why am I covering that for you, and what can we extract from this? Vitamin D is a vitamin which primarily promotes calcium absorption. So anything that you eat, if you have vitamin D in your system, it will promote calcium absorption, which leads to bone strength. But it also is responsible for other roles such as muscular health and actually probably most importantly in this context, immune function and reduction of inflammation. And some of you may recall that Director of Public Health recently talked about oxidative stress. This is inflammatory action. And the message that we are receiving about this infection is it's not so much the virus which is causing the illness, causing the disease, causing the harm to people. It's the reaction by the body to the virus and how the body is reacting, the inflammatory response. So vitamin D clearly and logically has a role in helping to relieve that. The issue is that actually very few foods themselves contain vitamin D. Fatty fish such as salmon and tuna, fish liver oils, these things have good sources, and actually we have quite a lot of vitamin D fortified in our food. For example, in the US, all milk is fortified with vitamin D. And breakfast cereals, if you look on the side of things like breakfast cereals, you'll see that vitamin D is fortified in there. And some other things such as orange juices, yogurt, margarine, and other food products. So vitamin D is there in our diet. Now, from our perspective, we are lucky because we live in somewhere with sun. And of course, some of these, particularly this Oxford University study, was carried out in the UK. Now, I appreciate that the UK gets some sun, but actually, on balance, they get more overcast days than they get sunny days, even down in the south and the southeast of the UK. So there is a scientific body that feels that even the laboratory testing levels of vitamin D, when we test somebody for vitamin D, are lower than they should be. And for good health, we should perhaps have higher levels of vitamin D. But of course, I would also then argue that please be careful of your skin, because we've all been in lockdown for a number of weeks. And if we go out now and spend 6 hours, which of course we shouldn't, maybe on our balconies in the sun, then you're going to burn your skin. So this, of course, is a bit of a balance. And of course, taking high doses of vitamin D is also not good for you. Everybody thinks that vitamins are fairly casual things. You can just throw a few vitamins in, make yourself feel better. But some vitamins can cause you side effects. And vitamin D is one of a small group of vitamins, the fat-soluble vitamins, which can cause stomach upsets, nausea, vomiting. And even if you take it in very, very high doses, it can cause you kidney failure. So my advice would be that if you're considering vitamin D is not there to prevent or treat COVID infections. It's there for good health. We get vitamin D in the sun. We may all have slightly less vitamin D at the moment because we're coming out of a winter and we've been in a slightly prolonged inside state because of lockdown. But it's part of good diet, good health, and getting some sun, of course, sticking to the rules and staying out only for 30 minutes. If you do decide that you need to supplement your vitamin D levels for any particular reason, make sure it's part of a balanced diet. If you want to take it, you can buy a multivitamin, but make sure that that multivitamin is part of a balanced palette of vitamins, and have a look on the side of the vitamin container itself, and it should say a little thing called RDA, which is recommended daily allowance, and it should say 100% or less. Don't be persuaded to buy 1,000% RDA or anything like that. The additional vitamin D will not give you any better boost to your immune system, better boost to your health. Moving on now to another study. This was about other respiratory viruses. And a study actually showed that out of over 1,200 people, 3% of those who tested positive for COVID infection were also infected with other respiratory viruses. Now, the reason I discuss this is because if you recall very, very early on in our journey, we did ask everybody to consider having a flu vaccine. We did a much more heightened flu campaign in October, November, December last year, but still the uptake wasn't as good as we'd have liked it. And we urged a lot of people to have flu vaccine, and I know we had a surge of flu vaccine uptake in January, February time. The reason is that flu vaccine itself doesn't protect you against COVID, but the flu vaccine will protect you against one of those other respiratory viruses. And if you think about your immune system, if it's busy fighting an influenza, that might then give you give the virus, the COVID virus, another opportunity to push your immune system and for you to get infected, and vice versa. If you have a COVID infection, your immune system may be under strain, and you may therefore be under pressure to pick up another respiratory virus. Instead of fighting one, you're now fighting two. So we are firmly out of our flu season, but we will mount another flu season campaign in October. And when we do, which is when we receive our flu vaccines, and we will, of course, order more this year coming. And I know this seems very early on, but I would urge all of you to consider putting this in your diary now. Ask us again after the summer. Perhaps that's not at a time when your minds will be on flu vaccine, but it's a good time to ask us and keep an eye on announcements that are coming out of the GHA. And let's get ourselves protected for this coming winter. Moving on, there was one small study. I'm speaking really quite, perhaps to a fairly specific cohort of people here, a small number of patients who suffer with multiple sclerosis, with MS. And I've had a look at a study there at MS patients. And of course, you've heard lots of things about unstable medical conditions and whether they increase the risk, or chronic medical conditions increase the risk of COVID or getting a severe COVID infection. There was a study of 232 patients who were found to have very, very mild, 96% of them had very, very mild infections, even those that had taken steroids. And I know a number of patients that have MS end up taking steroids on a regular basis, and there's a worry about their immune system. So this in itself is quite reassuring that in that fairly significant chronic medical condition, even with a treatment which can suppress your immune system slightly, the chances are it will be a mild infection if you get it. But of course, observe your social distance and just be careful not putting yourself at risk of picking the infection up in the first place. And then finally, one last one. This was something I want to bring up because there were a number of comments about skin rashes. I know everybody's seen lots of media coverage about skin rashes. There was a study in Spain which was published with 375 patients which found a range of skin rashes. But what's interesting is if you read the small print, it says these unexplained skin eruptions or rashes in those with suspected or confirmed COVID infection. So yes, some people with the infection developed a skin rash, which perhaps we couldn't explain otherwise, but a number of patients developed skin rashes with a suspected, not confirmed infection. And they were very strange. We've seen these pictures of children with a bright red tongue and this almost like a strawberry inflamed tongue and painful nodules on the hands and feet. But the rashes themselves, interestingly enough, were associated with less severe disease and in younger patients and on average lasted between a week and 12 days. And of course, a number of other viruses cause rashes, hand, foot and mouth. I'm sure many parents with young children are very familiar with that one, which causes rashes on the hands and feet and in the mouth as well. And viruses do cause rashes in general. So what I'm saying is please, again, I've said this many, many times, when you read the media, please don't be shocked when you see these very florid pictures. Viruses cause rashes generally, but the reassuring thing is, by and large, they tend to occur in young patients who tend to get away with these infections anyway, don't tend to suffer very well, and are generally associated with mild disease. But I would say the conclusion from this particular study about the skin rashes is be careful, please, not to self-diagnose that you have a COVID infection based on a skin rash. It could be one of any other viral infections, but please seek medical advice. So call 111 if you have any of the symptoms or if you're worried about something, or call us on the 2007 910, which is the primary care line. And so finally, from me, just a quick couple of thank yous. Thank you very much to Holly and Amber Swain for your rainbow card, which I have here. Thank you very much. And to Eva Lucia Montegrifo, again, for your rainbow card as well. Very much appreciated, or delivered through my post box. So my final thoughts for today. We've said this on a number of occasions. Please be patient. The unlocking, the gradual easing of restrictions is coming. We, and when I say we, I mean us as a community, us as a front line, us as the GHA, we are ready for a possible surge. And if we do see a possible surge due to the easing of the lockdown, that's very much something that we are anticipating and we're working to be ready for. Let's hope it doesn't happen, but if it does happen, we are ready. But what we would like, if we do have a surge, is a small surge, something we can deal with, something we can take care of, as we have done so far. We will all be getting back to normal. The GHA is getting back to normal. We will get there eventually, but we must be slow and gentle about it. Give everybody a chance, gentle steps, so that we can deal with anything that comes our way. And in the meantime, keep up all the good habits that you've developed. Keep your exercise going. Please don't be tempted by the car. Leave it outside. leave it in the parking space, leave it in the garage. And if you do drive, and I know from personal experience, I've not been in the car for a long time, so if you do drive, be careful and remember that there are many runners and cyclists on the road who have got very used to the roads being much quieter. So please just be aware of what's going on around you and be careful of the people around you. Don't sit on symptoms. If you have medical symptoms, don't delay now. Call us 111 2000 7910 as a good starting place. Seek some advice. Stick to the rules. Wash your hands. Social distancing. I know that we're saying this every time. I know this is becoming repetitive, but it's the one element of all of the advice. I give you these studies, these research papers, but as many of you who are listening all along have noticed, sometimes the advice changes. But every time we tell you the same advice, because it's the advice that is consistent and that will get us through this. Wash your hands. Social distance 1.5 to 2 meters. That's both people if you're talking to somebody else with arms outstretched. 1 bench length, half a parking space. That's a good estimate. And trust your instinct. I said this before. If you feel uneasy about walking into a place where there seem to be a lot of people, don't go. Turn around, don't stay, go home, come back another day. Your health is more important. Surely that can wait. Look after yourselves and look after each other. Thank you.
Thank you very much, Krish. So we're starting with questions from the media. I think it's the media in the room first, and then the virtual questions. So,
Dr. Garcia, can you comment on the removal of benches in Main Street? Is this related to the COVID emergency?
It is related to the COVID emergency. If I'm not mistaken, this is one of the issues which was raised during a meeting of cabinet or in one of the ministers' chat areas. And the view was taken that there were gatherings taking place around benches, and it was better to remove them completely rather than risk large numbers of people congregating around them. So that is perhaps the bad news, although obviously it's happening for the right reason and for a good reason. But the good news is that while the benches have been removed, they're all going to be refurbished. So when they come back to Main Street, they will be looking better than ever before.
I'm just wondering how challenging it is to maintain the Majax posture where returning to normal business practices where possible.
Sorry?
I'm wondering how challenging it is to maintain the Majax posture whilst we return to normal business where possible.
Well, there has to be a balance, and that is what's happening at the moment. That is to say, the government has issued advice to the general public and to the business community on what it is that they should do in the lockdown. We believe enforcing the rules and making sure people stick to the rules during lockdown is more important than perhaps it was before that, because if there is a spread, an increased spread of the virus, whether it is as a result of people going to shops or to take part in activities which are available now, which weren't available before, and that will encourage people to go out, as we saw in Main Street on Saturday. That's led to the removal of the benches from Main Street, for example. So we have to balance both. There has to be an opening, a gradual, controlled, and well-managed opening, which is what we're trying to do. But the ultimate effect of that really is dependent on the public and how the public behaves. So our advice is really very clear. Maintain your social distancing. Krish has explained the question of wearing masks if you're going into an enclosed area, members of staff in shops wearing masks. So we need to balance the two. The answer to your question is really that we need to balance both, and we need to move forward in a gradual, a controlled, and a responsible way.
And if I may just add to that, of course, the GHA are in a Majax posture. And what's very interesting about that is you're absolutely right. I suspect your question is aimed on how hard is it to maintain that over a long period of time. We have teams who are working 24/7. I have consultants who are 1 in 2 when they're ordinarily be on 1 in 4 or 1 in 5 rota. So it's very straining. However, we look on the other side of it. That we have changed some of our practices, which has stood us in such good stead for this. We have regular communication meetings and update meetings every single day. We have central coordination meetings. We have central coordination meetings with cabinet, with government, with civil contingencies teams. So even just from that operational perspective, while it's straining in terms of maintaining it, There are massive, massive positives out of being where we are in terms of major incident.
So what you're referring to is the major incident. So that's not quite the terminology that we use ourselves, which is why I wasn't quite sure what it was you were referring to. But as Dr. Awal has said, there are, for example, the civil contingencies team that leads on this is involved in 10 or 12 meetings every day as a result of that posture. And we need to balance the two. We need to balance the meetings and the effects that it has. For example, Platinum, which sits at the top of the major incident, used to meet every day at around noon. We are now having meetings every 2 days because obviously the situation is less severe than it could have been. But we are in constant and continuous control, exchange electronically at the same time. So it's difficult. We are doing both. We have to carry on with normal life, carry on with what needs to be done, but at the same time maintain the posture of a major incident. And we need to balance the two, and that is what we're doing.
Dr. Rawal, I just want to refer to the tests that you've done, the targeted testing. In respect of the targeted testing, were there any number of people who were diagnosed to have the disease, and were they Gibraltar-based or based across the border? And how can you tie the testing in with the retesting of these people once they have been once they have recovered, as the Chief Minister spoke about on Monday, I think it was?
So we've always talked very much about those two different strands of testing. The first one is, of course, the symptomatic testing, which is where we started, really. So anybody who develops symptoms calls 111, and we will swab somebody and test them accordingly. And then they will, if tested positive, have a period of isolation, and then after a period of time, they will be able to, with symptom-free, be able to go back to work, go back to normal life. In terms of the targeted testing, so we did two, really, as Deputy Chief has mentioned. We did the random testing, we've done the targeted testing. From the targeted testing, which actually is not complete, because the targeted testing is still ongoing, and we have a number of areas of the front line that we are dealing with, and as I said earlier, we're also going to be swabbing the teachers as well, who we consider to be part of the front line. So of all of those, so far we've picked up two, and they are Gibraltar-based. So this has not come from across the border. Of course, we have a very small number of people coming across the border, but there's only two, which is really consistent with the fact that we have very, very low community levels of this infection. And it's a good, it gives us two things. It gives us a bit more of that idea of the prevalence of how much infection is in the community, but it also gives us a bit of reassurance about where we are with our front line in terms of the fitness of our front line to carry on working, carry on doing what they've been doing incredibly well over the last number of weeks. And actually, if you think about it even more, most of the frontline workers are now exhausted because they've been working for so long. So even better that they're still fit and well. And secondly, it just gives us a reassurance that at this moment in time, our frontline are still without infection and therefore able to talk to the general public, talk to patients, talk to the clients that they're dealing with.
Can I just say, in terms of the border, you need to bear in mind that we are looking at a situation where there were 34,000 people crossing the border on a daily basis. That number fell to some 1,700 or 2,000 people a day. That has now gone up slightly as a result of the opening, but again, it is nowhere near the kind of figures that we were used to. And in addition to that, the numbers in Andalusia, the numbers in the province of Cádiz, and particularly in the Campo area next door, are actually amongst the best figures in Spain. So we know the virus here is pretty much under control at the moment, although things could change very quickly at any time. In Spain, in this area of Spain, the area immediately next to us, it's also pretty much under control at the moment.
Thanks, everyone. I'll now read some questions that have been sent in to us. The first is from the Panorama, and it's for Dr. Rawal. How many non-COVID medical procedures have been postponed due to the reorganisation of medical services, and are any patients being put at risk?
I can't give you an exact figure. If you recall, when we started this, we stopped all routine clinical work to increase our posture, ready to deal with an anticipated surge in infections, and also to stop people coming into hospital and increasing their risk of getting it and therefore spreading this infection. But what that doesn't translate into is that we've not stopped everything. So we've carried on with anything that has been urgent, anything that has been emergency, anything that has been part of the 2-week cancer referral pathway. We have carried on with those. So really this is all about risk balance. So we've tried to avoid bringing people in where the risk of bringing somebody in when we have high levels, or even if we're declining levels of infection, but levels of COVID infection in the community, we try to avoid bringing people in if that increases their risk of catching the virus. But it's a balance, really. So we are now at that stage where restarting the clinical activity is understanding that there may be people at home who now have not had their routine review and perhaps should have been seen a little bit earlier. So that's why we are ramping up now. So in terms of the absolute figures, I can't give you an exact figure because that figure is very variable on activity on any particular day or week in the hospital and different procedures. But I would say that we stopped pretty well all of it. We've kept going with the emergency stuff, but we are now coming back online.
Thank you, Dr. Rawal. Our next question is again for you, this time from YGTV. Some reports have emerged from the UK of COVID patients whose condition deteriorated very quickly while at home. Many of them were in contact with the UK 111 service throughout, but no ambulance was sent. Can you talk us through how the 111 team in Gibraltar monitors the progression of a patient's symptoms, what health professionals are involved, and what are the key signs that would trigger an emergency response?
Okay, so we actually have a number of avenues that keep track on patients who are tested positive. So the first part of what you said is absolutely right. There are a number of cases where patients have almost felt like they've recovered and then have gone rapidly downhill and have deteriorated. That's not across the board. That's not with everybody that gets this infection. Bear in mind that the vast majority of patients have no symptoms whatsoever or just a mild illness. But some of those people who have developed it have deteriorated rapidly. So what we've done and what we did put into place when we started to understand this is daily calls. So somebody who's tested as positive is called every single day. And they are asked how they're feeling, whether they have the same symptoms, whether the symptoms have settled, whether they're feeling worse. And of course, some of that information you can actually glean over the telephone, because if somebody is not speaking to you on the phone or is very breathless on the phone, then that in itself gives you an indication of how they're feeling or not, as the case may be. And some people have been reluctant to call in with these symptoms. They think that they're just kind of getting better, but a bit slowly. And I'm sure there are many people watching out there who've had coughs and colds in the past, completely take this away from the COVID, have coughs, colds, sore throats, chest infections, where they felt they're getting better and then they've taken a little downhill. And this is all part of almost like that modus operandi of viruses. That's sometimes what they can do. But we keep a track on everyone daily. That's that little point that I made the other day about the difference between an active case and a recovered case is a clinical assessment. This is not based on a textbook or a blood test or another swab. It's based on a clinical assessment. So the only way to do that is to monitor people daily.
Thank you, Doctor. We'll return to the floor. GBC, please.
Dr. Garcia, we've heard you repeat the government's advice once again today about the use of the beaches, about how you're only supposed to go there for half an hour, no sunbathing, etc. Coincidentally, we've got someone at the beach there right now taking footage. There are hundreds of people there. A lot of them are sunbathing. Clearly, they're not following government instructions and suggestions. They're obviously taking liberties. Is it time, perhaps, for the government to start thinking in terms of enforcement rather than repeating the recommendations over and over again?
Bear in mind that there's so much that the government can do. But what I can definitely say is this, that if people do not follow the advice which has been given and people do not listen, then there is a serious risk that in 10 to 14 days' time, we will suffer the consequences. I mean, the advice is very clear. In terms of the beaches, it's also very clear. You can use the beaches to exercise. We cannot go to the beach as we've been used to going for decades. You can go there for a swim, you can go for a walk, you can go for a run. And your whole beach experience has to be over in half an hour to allow time for other people to come along after you to be able to do the same thing. And we need to manage this ourselves as a community. I mean, the Royal Gibraltar Police and the other agencies are doing a fantastic job themselves. They inform people when they arrive at a beach. These are the rules. This is what you have to do. By and large, people have been complying. When they haven't, or when the situation became particularly difficult because there were too many people present on the beaches were closed, and that is a risk that we're taking if we don't follow the rules. And so it's twofold. First of all, those who don't follow the rules will spoil it for everybody else. And secondly, we may arrive at a situation in 10 or 14 days' time when the spread of the virus is complicated and is made worse by these people who are not following the rules.
Yes. So is it the case then that whenever you see that people are abusing the rules and not following the guidelines that you're setting out for them, that you take the decision to close the beaches for that particular day or whatever? Is that what's going on? Is that what's happening?
I understand operationally this is run by the Royal Gibraltar Police with the other agencies under the Civil Contingencies Department and chaired by the Minister for Civil Contingency, Samantha Sacramento. So the RGP will take an operational decision at a given moment in time if they find that they need to close the beach. That in fact already happened. It happened last week on Saturday when beaches were closed. It is possible that it will have to happen again if people do not follow the rules. At the end of it, this is not something which the government particularly enjoys doing. I myself go to the beach regularly, particularly obviously at weekends in summer. It's simply not possible to go to the beach as we have been used to in the past. We need to adapt to a new situation which affects not just beaches, but every area of our lives is going to be affected in the same way. Obviously, we understand that as we are now coming into summer, the weather's warming up, people want to make use of the beaches. But if they do, they have to follow the rules and behave in a sensible and in a sensible and a proper manner.
Dr. Garcia, could you expand a bit on your contact with the All-Party Parliamentary Group for Gibraltar? For example, were its members surprised by the low levels of infections here? Do they consider there's lessons to be learnt from how we've dealt with the situation here?
Well, but bear in mind, our team in the London office is in regular touch, although the director is here in Gibraltar, but is in regular touch with members of Parliament in the United Kingdom. So they were aware of how successful, if I may say that in inverted commas, Gibraltar has been thanks to the combined effort of the GHA and all the community pushing together, how successful we've been in containing the virus. They were aware of the fact that to date nobody has died as a result of COVID-19, and they were very complimentary of the way in which Gibraltar have dealt with it. So they were already aware of the issues in relation to Gibraltar and COVID-19. We had a good discussion with them, which went on for about an hour. There were a number of questions posed by both members of the House of Commons and also by members of the House of Lords around the COVID-19 issues, with a few words in relation to Brexit here and there. But it was mainly the thrust of the discussion with members of the All-Party Group was to do with COVID-19. Are there any other questions?
Yes, from on the press and then two from home, please.
Deputy Chief Minister, the Chief Minister announced as part of Unlock the Rock that he was going to pedestrianise areas like Line Wall and Europort Avenue and Chatham Counterguard. As the minister responsible for planning, have you considered the problems this could cause, especially in terms of traffic, and has there been much consultation with stakeholders, considering that on June the 1st this is supposed to take effect?
Well, first of all, let me say that I'm not the minister with responsibility for town planning. That was the case since I took over responsibility for Brexit. So I'm not, although I sit on the Planning Commission. This will be primarily a question for the Traffic Commission, which is the one that deals with this issue. And the lead department would be the Ministry for Traffic, obviously, which would be implementing the whole thing. But other departments would also be involved. I think the Chief Minister made clear two things. First of all, that this would be a pilot project. So we do it and monitor and see how it works. And he also made it clear that there would be consultation with stakeholders and with interested parties. At the same time, there would be, for example, residents would not be affected by this. People who have businesses, deliveries to the area, they would not be affected either. Neither would public service vehicles, official vehicles. So I think the general effect in terms of the measure would be limited to those people who use the road to go through from one end to the other. They don't live in the area, they don't have businesses in the area. And the effect would be to push traffic outside to effectively the two ring roads, which are Queensway on one side and the East Side Road on the other. But as I said, this is a pilot project. There will be full consultation with the stakeholders, and those who are already there and who have passes of different kinds will not be affected by the measure in any event. But it certainly would have the effect of reducing traffic, reducing noise, and reducing pollution, which would be very beneficial to the whole community. Any other questions?
Yes, thank you. I'll read out two from home, please, now. The first is from the Panorama. It's for you, Dr. Garcia. Is there any further news about airlines flying to Gibraltar, and to what extent will this affect a return to normality at the airport?
Well, a return to normality in relation to airlines, airports, and air services in general really depends on one important factor, and that factor is confidence. When do people feel confident enough to be able to fly? Because that will create a demand, and airlines will then be interested in developing routes which are economical and which will lead them to make money. So the situation here is as follows. First of all, in relation to British Airways, we have agreed a schedule with them. They started the new schedule today. They will fly to Gibraltar 4 times a week throughout May. We're now looking at extending that to June and July and up to the beginning of August. Those discussions are already happening with my colleague, the Minister for Tourism, PJ Darianani. Also with EasyJet, I know he's having discussions as well. As you know, EasyJet flew the routes here to Gatwick, Luton, Manchester and Bristol, and had announced a new route to Edinburgh in March, which sadly never took off because of the coronavirus, COVID-19 issues. So with EasyJet, want to start slowly and want to start developing routes at the same time, but we don't have an indication of a firm date as to when that is going to happen. As I said, this is something which is happening all over the world, and I expect the airline industry to be hit by this measure. We've seen already major airlines announcing redundancies, so whatever happens here will happen slowly. We are, in a sense, lucky to have a lifeline route to the United Kingdom. This is only one of very few routes into the Iberian Peninsula, and we're lucky that it is from Gibraltar. We're able to access the UK to bring over specialist personnel, to bring over supplies, to bring over the post, particularly in these times of a major global pandemic. But I think the airline industry and the airport will develop and evolve slowly, and I expect this to happen overnight.
Thank you, Dr. Garcia. Our final question today is for Dr. Rawal from Your Gibraltar TV. Is there any link between the severity of symptoms and the number of times someone has been exposed to the virus? If there is, what measures are in place at the GHA, apart from PPE, when treating COVID patients to limit such repeated exposure?
Like we've said many times, you know, the evidence about this, the understanding about this virus is emerging. There is some evidence to say, and I know Director of Public Health has said this before, that it's not necessarily about the number of times that you are exposed to it, it's about what he calls the viral load. So if you are exposed to somebody who's heavily viral, you're more likely to pick it up, or somebody who has only a mild level of the virus. And that's really the understanding that we have at the moment. But of course, you know, a lot of our understanding is very new. So we haven't, when I say we, I don't mean Gibraltar, I mean globally. There hasn't been as much study into that as perhaps we would like, because everything is being studied into. In terms of how that would affect the GHA, I don't think it would affect the GHA at all. So if somebody tests positive, or we suspect somebody, particularly somebody who we would admit into hospital, we will keep them in isolation. We will assume that they have the infection until the swab proves otherwise. So we will always keep them in isolation to prevent that spread to somebody else, to protect the other patients in the hospital. And of course then we will work on a clinical diagnosis, we will swab them, we'll do the blood test, we will support them, we will treat what we find, and we will look after them accordingly. So that's maybe something that we can update you as the research goes on, but for the moment all I can say is I can assure you that we work on every single case according to how they present.
Thank you, everybody. There's no further questions today.
Thank you all then. Thank you all very much for your questions. Thank you, Krish, for
Thank you.
coming here with us today. And before I repeat our public health advice, let me just tell you that tomorrow you will be joined by my colleagues, the Minister for Digital Services, Albert Isola, and my colleague, the Minister for Education, Gilbert Likudi, who will be here to address you and to answer any questions or concerns that you may have. So I'll just repeat our public health message, which is to listen and act on the advice of our public health experts. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, please stay at home. Maintain social distancing. Do not mix with people from other households. If you need COVID medical advice, then call 111. For non-medical issues, call 200 418 18. For non-COVID medical issues, call 200 722 66. And for emergencies, call 190 or 199 as usual. Stay home, stay alive. Thank you.